How important is your knowledge about the basic first aid concepts? It's essential to understand basic first aid concepts so that in the event of a crisis such as an injury or an accident, you'll have the confidence to help a person in need and potentially save their life. Giving appropriate first aid immediately can help reduce a person's recovery time and make the difference between the patient having a temporary or long-term disability. In your young age, what do you think are the ways that you can do to save life? At my young age and as a student, it's important to be knowledgeable about the basic first aid concept. Knowing what to do and providing a quick response could be able to save a life. In an emergency, attempting some first aid care is better than doing nothing. A person that is trained and knowledgeable can be extremely helpful in assisting the injured person or people until emergency responders arrive. What do you think is the value of having medical first aid kit at home or in office? It is critical to keep a first aid kit in your home or in the office. You never know when or where an accident will occur. Therefore, we must always be prepared. It keeps an injury from getting worse and may save you from having to go to walk in clinic or in the hospital. Following accidents, help the person to lie down. Apply an ice pack to the injury for up to 20 minutes. This will help to reduce the pain and swelling. Do not move the casualty unless there are life-threatening hazards. He or she may have suffered a neck or spinal injury from the fall. Tell the casualty not to move his or her head. Place two objects, like bags or cushion, on both sides of the head to keep it in that position. If there is no improvement, advise them to seek medical advice. Choking accident. Stand behind the person who is choking. Place your arms around their waist and bend them forward. Clench one fist and place it right above their belly button. Put the other hand on top of your fist and pull sharply inwards and upward. Repeat this movement up to 5 times. Drowning accident. Check to see if the person is conscious or unconscious. If the person does not respond, check their breathing. Ask someone to call the 911 or emergency hotline number. Start cardiopulmonary resuscitation CPR. Repeat mouth-to-mouth resuscitation twice, then do CPR once until the person wakes up or until the ambulance arrives. If the drowning person starts breathing again before the ambulance arrives, they must be warmed up with clothes or blankets and their wet clothes must be changed. Monitor the patient and keep checking their pulse and breathing until the ambulance arrives.